can make that better. Tune in to the Ateneo Senior High School's first radio program, SOAR, the Seniors On Air Radio. Don't change that channel yet, because SOAR is ready to put the you in youth. SOAR, Seniors On Air, here on Radyo Katipunan, 87.9 FM.
Radyo, 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 Katipunan. Radyo, radyo, Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan.
Coming up next, Cura, conversations on care, health, and healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan, radyo, Katipunan, radyo, Katipunan, radyo, radyo, Katipunan, radyo, Katipunan. Sa Vlog Blue Eagle kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista sa loob sa labas ng eskwela, ating ibibida lahat ng kwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero sugod, todo sa kayod, dunong at tulog. Lipat na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan.
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo Way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Magandang gabi, Ateneo, and welcome back to Cura, Conversations on Care, Health, and Healing. I'm Dr. Tipi Sumpayco Tanchanco, and with me,
I'm Dr. Jello Apostol. And I'm back.
Yes, he's
Dr.
back.
P. And you know what? For today, Dr. P, we're
Yes.
talking about something that has been most requested ever since we started Cura. And it's something that puts us at risk.
Yes.
More than half of the Filipino population. Breast cancer.
yes, and here's why it matters so much. Breast cancer is the most common cancer among Filipino women, and every day, Filipino women are diagnosed with breast cancer, and many are facing this diagnosis feeling scared, confused, and overwhelmed with information that they don't understand.
Super agree, Dr.
Yeah.
P. But here is what we want our listeners to know right from the very start. Breast cancer, when caught early, is highly treatable. And many aspects of breast cancer are actually preventable, Dr. P, through the choices that we make every single day. And you see, this is not just about medical treatment.
Right.
It's about empowerment talaga, Dr. P.
Agree ako dyan, Doc Jello. Empowerment talaga, no? So, today po, we're going to demystify breast cancer. We'll talk about who's at risk and why, how to catch it early, why screening really matters, and yes, we'll address treatment options in a way that makes sense, not through confusing medical jargons.
And also something to add to the conversation. Sabi nga natin, no, even the environment and our lifestyle, things that we can modify, no,
Yes.
also affects breast cancer. So everything from yung mga plastics, di ba? Do plastics cause breast cancer? Pag-uusapan po natin yan, to air pollution, to the chemicals that we see even in everyday products. We'll try to, bust certain myths but also confirm certain facts that many of our listeners might not know.
Yes, and whether you're a woman trying to protect yourself, someone supporting a loved one with breast cancer, or just wanting to understand the disease better, today's conversation is about knowledge, prevention, and hope.
And to help us with this conversation on breast cancer and hope, we are incredibly honored to have with us today Dr. Pierce Cao. Hello, Dr. Pierce. Dr. Pierce is a breast surgical oncologist and director of the Breast Center at the Medical City. Dr. Cao completed her fellowship in breast surgical oncology at the National Cancer Center in Singapore and is a fellow of both the American College of Surgeons and the American Society of Breast Surgeons. So hello, Dr. Cao.
Welcome!
Thank you for having me. The honor is mine.
Yan. Tawagin lang natin siya Dr. Pierce.
Dr. Pierce
Mas
na lang.
tawagin
Yes po.
siyang Pierce. Okay, so Dr. Pierce, you're also an Ateneo alumna, biology from Ateneo. Actually po ngayong gabi, 2 valedictorian po ang katabi ko. Napapagitnaan ako ng 2 valedictorian dito.
You're selling yourself short.
Tapos itong si Dr. Pierce po ay clinical lecturer din sa Ateneo School of Medicine and Public Health. Pero tatanungin ko muna namin, personal question muna. What drew you to specialize in breast surgical oncology? Parang surgery na nga, di ba? Tapos breast, tapos oncology. Like, what drew you into the field?
Actually, the field chose me. No? During residency kasi I saw a lot of women with huge weeping, foul-smelling breast lumps. And I thought to myself, there must be a better way to help out these women. And then, is there a way to prevent and to give them better care? So, here I am.
Parang na-draw ka sa kanila.
Yeah.
And Dr. Pierce, di ba, parang you're also the director of the Breast Center at TMC. So, you see the full spectrum, Dr. Pierce, di ba? Everything from prevention to yung sinasabi nyo nga po, no? Women with breast cancer already at the late stages of their disease. To kick things off with our conversation, Dr. Pierce, what is something you wish every Filipino woman knew about breast cancer?
Like what you mentioned earlier, breast cancer at an early stage is actually treatable with excellent prognosis and survival rates. No, so if caught early, you really have all the whole gamut of treatment options available to the patient. So that's why screening is very important.
Wow. That
Treatable
brings so
when
much
caught
hope,
early.
no?
Yeah.
Oo nga.
Galing.
Sige, pag-uusapan natin yan. Magdi-deeper dive po tayo. So, let's start at the beginning. So, Dr. Pierce, in very simple terms, ano nga ba ang breast cancer? What's actually happening sa body, sa breasts ng women?
Breast cancer is actually just a bunch of cells, which has, for some reason, mutated, grown out of control, and then it forms a tumor. That tumor continually grows, and then it goes beyond the breast, and it spreads to the other parts of the body. Basically, that's what breast cancer is.
So, it's really our body getting out of control, no? Parang...
Yeah. So, parang cancers in general, no? Except
Yes.
ito talagang
Specifically the
breast
breast.
tissue. Oo.
Yeah.
And sabi Dr. Pierce, no, na parang there's a lot of women who think na parang hindi naman yan umaandar sa pamilya namin. And actually, a lot of people also think that it's only a women's disease or problem. So who is actually at risk when we talk about the risk of getting breast cancer? Who is at most at risk, Dr. Pierce?
Everyone is at risk, no? As you mentioned earlier, unofficially, all women are at risk, but also men. No, being a woman is a risk factor, but men can also have it like in less than 1%, but it's still possible.
Kasi may breasts din naman ng men.
So we're
Diba?
not exempted pala,
Hindi ka
no?
exempted.
Naku, akala ko
Naku
parang...
po, kala mo, wala nang risk at all.
Oo
Meron din
nga.
pala, no? Okay. And di ba minsan kasi akala mo parang, this will not happen to me. Pero parang, okay. Sige. So, Actually, important yung last point na yun, ano. Most women with breast cancer have no family history of breast cancer. So let's talk about the women who the factors that women can control. When we talk about factors that puts us at risk, no? So what lifestyle choices affect breast cancer risk? Meron ba, Doc Pierce?
Actually, yung what you mentioned earlier, majority of breast cancers have no family history. Only 5 to 10% of the entire breast cancer population. Yun talaga yung what we call hereditary breast cancer.
Konti lang.
Konti lang. So, mas common talaga yung wala, no? And then for risk factors, these are factors which can increase our risk for breast cancer, no? So, meron tayong modifiable and non-modifiable risk factors. Non-modifiable like age, we can't change our age, no? Our family history, of course. Some of us would want to change our families, but no choice, no?
Walang choice.
Yeah. What about if you have early menstruation or late menopause, no, or not having given birth, or starting to give birth only at at least 30 years of age. So these are all factors which can increase your risk.
Yeah. And why are those the factors, Doc Pierce? Like, 'di ba, parang early menstruation, late menopause, like bakit
And
yun
not
yung
having
mga factors
kids,
na
no?
yun? Oo.
Kasi it increases your exposure to estrogen, which is the
Okay.
main hormone which stimulates the breast.
Okay, so I think
Oo.
important din yun, ano? Kaya higher din in women. Ang men ba may estrogen din? Parang
Merong conversion.
may conversion, di ba?
Yes.
Kasi testosterone kailangan din ng
Yes.
women. Okay, sige.
So would you say, Doc Pierce, that really at the center of what causes breast cancer is really estrogen, no?
Yes.
Our estrogen
Hormones.
hormones.
Yes, hormones.
And to your point, no, parang, so may parts inside our body that affects our estrogen levels, but there are also lifestyle factors, sabi mo nga, no, Dr. Pierce, no, parang what you eat,
Nagpapataas din ng
your
estrogen.
exposures, no?
Right.
So what you're mentioning are the non-modifiable, or sorry, the
modifiable.
modifiable ones, no? Like when you're obese, or if your weight is more than 30% of your ideal body weight, if you're taking in alcohol at least 30 grams a day, if you've never breastfed, if of course you're taking hormonal replacement therapy for at least 10 years, then it all increases your risk. Again, this is exposure to more estrogen as well.
Right.
Wow. And ang interesting po, Dr. Pinong sinabi ni Dr. Pierce, no, na parang not breastfeeding can also put you at risk for breast cancer. So we actually would want to promote breastfeeding as well.
Yeah, kasi when you do breastfeeding, it interrupts the cycle of estrogen eh. So nagkakaroon ng progesterone, so mas slightly decreased, no? They say you have to breastfeed for at least 6 months to 2 years to get some form of protection.
Actually, yun
Yeah.
naman yung recommendation talaga, di ba? WHO recommendation is breastfeed at least for 2 years.
Pero Doc,
Diba?
ang galing lang kasi ako mismo hindi ko alam yun. Sinasabi natin breastfeeding is good for the baby.
It's
Kasi
good
it
for
gives
the
him-
mommy din pala.
It's good for the mommy din pala, especially when it comes to protecting you from breast cancer. But Doc Pierce, I'm an environmental health practitioner, and one of the things that I'm interested in is may mga nagsasabi, some studies say that there are certain environmental factors or chemicals in the air that we breathe or the food that we eat that have been linked with breast cancer. How true is that? What does the science tell us about these environmental factors?
Actually, it's good that you mentioned it because recently studies have come out mentioning these EDCs or endocrine disrupting chemicals, which can mimic hormones in our body, and they interrupt the cycle of the hormonal environment, causing potentially cancers, no? And I know this is very close to your heart.
Yes,
no?
Doc.
So we
Oo.
should ask you about this as well later.
Ikaw nga.
This is your expertise.
Oo.
Oo.
Kasi narinig ko, Doc Pierce, no, well, air pollution, di ba? Parang, kasi ngayon lumalala yung air pollution. But I think what I've read, Dr. Pierce, then is certain chemicals, no, like yung mga plastic products.
Yeah.
plasticizers, BPAs, no, phthalates have been linked with breast cancer.
And these are everyday chemicals, di ba?
And
Jello,
parabens.
oo.
Parabens.
Yeah.
Doc Pierce, like, where do we usually see these parabens?
Ano nga ba parabens? Pakipaliwanag nga from an environmental
Mental point of
perspective.
view. Sige
So,
nga.
you know,
Sige nga.
parabens are these chemicals that typically we find in personal care products.
And they're used as like
Lotion,
preservatives
shampoo.
ba?
No, as
Or
preservatives,
carriers
yes,
or something.
oo.
Oo, okay.
So, shampoos, lotions, no? Kaya very important
Okay.
talaga na basahin yung
Oo,
nakalagay
diba?
sa...
Kaya ka may makikita ka sa ibang makeup or mga lotion, pero sinasabi na no parabens. Important pala, binabasa din yun. Okay,
Pero,
yeah.
Doc Pierce, you mentioned yung endocrine disruptors.
Yes.
Dr. P.
Maganda siguro intindihin din natin. Ano ba yung mga endocrine disruptors? You mentioned it a bit. Maybe you can also expound on endocrine disruptors. Kasi we hear a lot about endocrine disruptors. It's everywhere. It's in plastics. Like, can you comment on that as risk factors for breast cancer then?
Well, theoretically, diba, we talked about estrogen as the main hormone stimulating the breast. So we find these pseudo hormones which mimic nga and interfere with the metabolism of hormones stimulating the breast as well. So you have disruption in the cycle, and we know that the breast is very sensitive to the hormonal environment it is in. Parang, di ba, usually we have feedback mechanism. So it disrupts that feedback mechanism that we're so used to. It's a very parang fragile environment. And that's why it's being studied now, because it theoretically in animal studies, they have shown that they can cause proliferation of breast tissue. So far in animal studies. And I think there was a paper saying that in one breast cancer patient, they saw phthalates in the breast. So
Talaga?
yeah,
In breast tissue?
and breast
napupunta pala
breast
siya doon.
cancer.
Okay.
So, you know, it's still an ongoing. It's a very
It's an area of research.
yes,
no?
it is.
Oo.
It is. No, more and more studies are ongoing. However, it's mostly animal studies because of ethical reasons. We cannot study this on humans and expose them
Oo
to
nga.
potentially harmful agents, diba?
Right. Kayo ba, Jello, may mga studies din ba kayo on endocrine disruptors? I mean, from a public health perspective.
Yes, Doc. No. Actually, to Dr. Pierce's point, no, parang these are products that we encounter every day. Yung nabanggit nga na phthalates, BPAs, these are plasticizers. These are chemicals that we add to plastic products to make plastic more flame retardant, to make it harder or
Pati
clear
mga
or
pajama
colorless.
ng mga, di ba?
Oh, kasi di ba napaka-flexible, ang daming uses ng plastic, and you know, it's these plasticizers that add, you know, all of these different chemical properties and capabilities to plastic. And I think what's really worrisome about this is that, you know, a lot of people don't know about these things.
Right.
Diba? And even if, to Dr. Pierce's point, no, parang it has only been established in animal studies, very important din po yung sa environmental health, yung tinatawag natin na precautionary principle.
Ano yun?
Na we don't wait for, you know, the evidence to show up in humans to prevent us from doing something about it now. Diba? Like, we
Right.
can educate people, we can prevent further exposure.
Wala
But
naman kasing mawawala. Di ba? Kung
Totoo,
magsimula na tayo ng prevention ngayon pa lang.
agree. And I think we'll cover that later in our fact or myth segment, Dr.
Right,
P.
right. And speaking of prevention, pag-usapan na natin yung screening, no? So, Doc Pierce, can you walk us through screening recommendations? Like, when should women start screening? Paano ba mag-screening? Pakituruan nga kami.
So there's a controversy actually with screening. Abroad, they do 45 years old biannually.
45 years old. Okay.
Every 2 years. Pero, sorry, there is a disclaimer saying that you have to, it's a conversation with your doctor whether to do more intensive screening. But most cancer societies in the Philippines, no, we do at 40.
40. Okay. Yun ang medyo unique sa atin pala. 40. Pero 45, parang inisip ko, parang di ba late na yun? Di ba like, it's like we get a lot of cases na even younger people, di ba sabi mo, aging nga is a risk factor, but we now get like younger people na nagkakaroon din ng breast cancer. So, but we start at 40. But paano yun kung parang kinakabahan ako? Pwede ba ako magpa-screen earlier?
Of course, you can do screening anytime, but the recommendation is at least 40. You have to have a mammogram and an ultrasound.
Mammogram and ultrasound.
Yeah, that's
Kailangan
the basic.
sabay?
Yes, unfortunately, nobody wants to have a mammogram kasi iniipit, no? But right now, we have nicer machines na yung pag-iipit hindi na ganun kasakit. It's just quick, no? It's mostly discomfort. We need to do both kasi we're looking at two different things. Iba yung nakikita sa mammogram, iba yung nakikita sa ultrasound. So, it's like looking at something in a different way. So, we catch things differently. So, by doing them both, we increase the accuracy rates of detecting breast masses.
Okay.
So,
Yung pala.
yung magic number pala natin, Doc Pierce, Doc TP, is 40 and 45. But say, for example, Doc Pierce, I'm 35 years old or much younger. Are there certain like aspects or factors about my history or about who I am that should make me worry na
Parang ifa-flag ka na.
dapat siguro kahit 35 ako or 30, I should start having myself checked or
Yes.
consult a doctor?
You have a strong family history of breast cancer, such as yung classic na relationship, your mother, daughter, your sister, yan talaga yung red flag. You need to do earlier screening like 10 years before one of those family members got diagnosed.
So, ano ibig sabihin nun? Kung halimbawa na-diagnose yung mother mo at 40,
So you
30
need to,
ka pa lang?
30, you need to be screened already para to
Okay.
catch it early in case nga it's hereditary.
So in a way, parang may intergenerational responsibility din yan, di ba? Na parang for women na magpa-check ka ngayon kasi kung may makita now,
Right.
ma-advise mo rin no, yung mga anak mo, yung mga kamag-anak mo na magpa-screen sila much earlier, especially to Dr. Pierce's point na if there's
Right.
family history to it.
Anong direct line lang ba yan? Like, what if your tita has breast cancer? Kailangan mo rin ba magpa-screen? Or pinsan mo?
As long as there's family history, you need to put that in at the back of your mind that you have history, you need to get screened. But the strongest relationship is the direct line.
Right.
Oo.
And what about yung mga breast self-exams? Like, there seems to be some conflicting information about whether women should do them. May value ba talaga if you do breast self-exams?
Actually, maybe the last 2 years, it was no longer recommended according to international guidelines for the
Oh, okay.
reason because most women get so anxious and so paranoid that, that parang it's not healthy for them anymore, and sometimes they go see doctors, and unfortunately sometimes they get over biopsied. So
okay.
parang sometimes it's not needed, but yet they get biopsied, so it's no longer recommended. However, personally, I think that the only way for you to really know what's going on with yourself is to really examine yourself, kasi a lot of times it's the patient herself who detects the mass, diba?
Kasi may ma-feel sila.
Siguro we should just advise the patients that they have to not get anxious, be calm lang when they feel something. It's probably benign. You can go see a doctor and have yourself checked.
Right.
I don't think it would hurt naman if you examine yourself as
Yeah.
long as you're in the right frame of mind.
And may proper technique ba yan? Like, paano ba ginagawa yung breast self-exam?
Normally, we make it like a clock, like yung breast, no? We imagine it as a clock, and from the nipple and the areola, you use the
Palpate.
pads of your fingers, the
Okay.
3 fingers, and then you go circularly. You can also do it radially, pero it's up to you, whichever is more comfortable for you. As
Basta
long
lahat
as
makover
oo,
mo.
basta makover mo, and you make sure that you get more familiar with your breast, and you do it regularly. I mean, not regularly as in every day, maybe once every few months.
Baka naman mabugbog yun kung
Oo.
everyday mo gagawin.
Yeah, oo.
Okay, every few months.
Every few months, or just go see your doctor so that the doctor takes care of it.
Yeah, of doing the exam din, no?
So,
yeah.
and then Doc Pierce, and I think one of the greatest barriers then is, so a woman, say for example, does breast exam and then finds a lump. And then yung, to your point, they start worrying. So, if you were to like sort of lay out what the next step should be from, detecting a lump during your breast exam,
Or halimbawa naliligo ka,
Oo.
di ba? May na-detect ka bigla.
like, what would you recommend to a woman? Like, what should her next step be? And like, ano yung gagawin sa kanya if she decides to go to a doctor?
Majority of lumps are benign. No?
Ano po ibig
Majority.
sabihin ng benign, Doc
Ibig sabihin,
Pierce?
hindi siya cancer. No? 80% of the time, it's not cancer. And maybe 15 to 20%, it could be cancer. But for you to determine that, you need to see a doctor para the doctor can request for either a mammogram and or an ultrasound, and then we can have a better assessment as to what was seen in your results. So maybe
But
depending
how
on the
do you
results.
diagnose? Ano yung like parang gold standard? Parang ano ba yung paano mo malalaman paano na sure ka na cancer ba to or hindi?
Normally, we do ultrasound guided core needle biopsy. Basically, that means we're going to take out a little bit. We put in a needle, take out a small slice of tissue, usually mga at least 5 or 6 slices of tissue, and then we send it to the pathologist.
Masakit ba yun?
May anesthesia naman
May
yun.
anesthesia
Oo.
naman.
There's local anesthesia. It's the injection of the local anesthesia that's slightly painful. It's like tooth extraction, di ba? The dentist infiltrates the local anesthesia. And then afterwards, the patients, they don't feel anything. It's just, they feel the movement and the pressure. Pero wala namang pain.
And then, may recovery time ba yun pagkatapos mo mag-biopsy?
Halos wala. It's a tiny 1 millimeter incision. So they're up and about as if nothing happened. But of course, pwedeng may konting pain, a little bit of soreness, a little bruising. But basically, parang wala.
Sige. And pag halimbawa nag-positive nga for cancer, ano naman yung mga treatment options that's available? Yung sabi mo, di ba, parang marami nang pwedeng gawin, even if it's breast cancer. Like, ano na yung pwedeng gawin? Or options, at least.
Yes. For now, when you say breast cancer treatment, pwedeng you may have surgery, pwedeng chemotherapy, pwedeng radiation therapy, hormonal therapy, immunotherapy, targeted therapy. Sobrang dami, no?
Ang dami.
Yes, sobrang dami ng options. Ngayon kasi, we're talking about molecular level, it's tumor biology. Dati kasi it's
Ano
just...
yung sabihin ng tumor
Oo,
biology,
it's
Doc
like,
Pierce?
dati kasi it's like breast cancer fits all.
Parang
It's like
generic
one
breast cancer.
generic treatment for everybody. Now, it's based on the personality of the bukol. No,
Oh,
we check for the ER/PR HER2, the estrogen receptor, progesterone receptor, and the HER2 receptor. No, depending on the combination, minsan nauuna yung chemotherapy first bago surgery. And then minsan depende sa combination, nauuna yung surgery bago chemotherapy, or kung hindi naman kailangan, you skip it. No, so parang very personalized na nga siya, which is better for our patients kasi hindi siya one size fits all. Oo.
So, parang mas sakto para
Yes.
sa kanila yung
Yes.
intervention, no?
Yes.
So, Doc Pierce, pagkatapos ng biopsy, marami pang mga tests na kailangan gawin? Ganun ba yun?
Yes, once we do the biopsy, syempre we have to check whether yung cancer has spread to the other areas na ba, or is it still localized to the breast. So we have to check the liver, the lungs, and the bones. No? We have to check all of these things to see kung yun nga, naka-localize pa ba yung breast cancer dun sa breast lang. Oo.
Kasi nag-iiba din yung treatment pag
Yes,
kumalat
yes.
siya, ganun.
Oo, definitely.
Okay,
No?
yeah.
Doc Pierce, also going back to our patient kanina. So I was sabihin natin, no, a woman or a patient does a breast exam, self-breast exam, and then finds a questionable lump. How long should that patient wait before she starts to consider, okay, I need to go to the doctor? Like 1 month? Are we talking 1 month, 1 week? Or should she
Or
see a doctor?
mag-antay, diba? Pwede ba mag-antay?
Pwede ba mag-antay? Like, what would you recommend to that patient?
Preferably not, no? Actually, if I'm the patient, syempre, when you think about it, yung anxiety mo every day. Although, majority of the patients are that way. Meron din naman yung walang pakialam na iniiwan na lang na lumaki. But most people would worry about it. So I suggest you just go see your surgeon or your doctor para lang mabigyan ka ng konting assessment and to see kung may further testing pa ba kailangan. We wouldn't want to wait very long, especially if it's a very suspicious na result, no? It's suspicious, I would want you to see a doctor immediately.
Ano yung makikita mo sa parang sa breast para sabihin na suspicious to?
Parang
Meron bang
matigas ba
mga
siya?
signs
Oo.
ba yan?
Matigas,
Yung mga-
masakit, malambot, gumagalaw.
Usually yung classic description is yung matigas na bukol, hindi masyadong gumagalaw, and usually walang pain, pwedeng may discharge, bloody discharge, pwedeng parang may indentation yung skin, pwedeng mapula yung skin, parang may maliliit na bukol, no? So, or asymmetrical yung breast, no? These are the more common symptoms that we might see. But other times naman, they're just dots on the film. Walang symptom at all, walang bukol. No?
Talaga?
Yes.
Parang sama mo lang in
Yes.
sa ultrasound.
Yes.
So, Doc Tipi, ang interesting no,
Important
no? Parang kasi iniisip ng marami, naghahanap ako ng bukol, pero yung sinasabi ni Doc Pierce, minsan hindi siya bukol, minsan
Yes.
parang, para ba siyang dimple, gano'n, parang depression, parang gano'n ho ba yun?
Yes. Pwedeng depression lang siya.
Or namumula.
Namumula,
So, hindi lang pala siya bukol ang
discoloration.
breast
Yeah.
cancer. Okay. Doc Pierce, you mentioned something about how no two breast cancers are the same, and people talk about different types of breast cancer. Doc Pierce, can you simplify for our listeners? Ano ba yung mga general types ng breast cancers that we know of today?
Right. And is one better than the other? I mean, kung magkakaroon lang ako, ano pipiliin ko, di ba?
Sana naman hindi, di ba? Sana naman wala. Oo.
This is wood. Okay. So we have yung I mentioned tumor biology, yung biological subtypes, no? So now meron tayong tinatawag na triple negative breast cancer, merong HER2 positive breast cancer, may luminal A breast cancer, and may luminal B breast cancer. No? So
Ang dami pala.
oo, ibang-iba na sila. So yung mga hormone positive, ito yung mga luminal A and luminal B. They look exactly the same. Yung luminal A, it's parang a better type, better prognosis, parang safer, nicer type of breast cancer. Yung luminal B, it looks exactly like luminal A, pero tridor siya. It is
Deadly siya, gano'n?
more deadly, it has a worse prognosis than luminal A. Yung HER2 positive, and yung HER2 positive naman, aggressive siya because it likes to divide more cells compared to, it likes to grow more. Pero that's why you need yung anti-HER2 na medication. Pag nabigyan ka, supposedly, mas makokontrol naman siya. Yung triple negative naman, it doesn't have a good prognosis in a sense because wala kang mabigay. Negative kasi siya for hormones, negative din siya for HER2. So parang wala kang mabigay na gamot, wala kang mabigay na IV na drug para to control it. And it's usually seen dun sa mga hereditary type of breast cancers.
Ano gagawin mo for them? Kung
Ito,
triple
surgery
negative?
pa rin
Surgery.
talaga.
So,
And you
tatanggalin
also
mo.
need chemotherapy for this one. Pero
Okay.
it's like the general chemotherapy. Hindi siya as specific as
Right.
HER2.
So, kumbaga mas maganda kung mas specific yung
Yes,
treatment
yes.
na gagawin mo, no?
Oo.
Siguro less systemic effects din ba? Ganun ba yun?
Yes, kasi it's unlike before na you give this drug, you give that drug, pero ngayon mas specific for the cancer that you really have.
Right.
Oo.
And yung treatment na yan, lahat ba nitong treatment na to may side effects?
Yes, unfortunately wala pa tayong nai-invent na medicine. I mean, paracetamol has side effects.
Right.
So it's the same thing as the drugs. All the chemotherapeutic drugs, even the hormonal therapy, they all have undesirable side effects, which we have to disclose to the patient. But until better drugs come out, I mean, we're stuck with these drugs which have been known to be effective for breast cancer naman, kaya lang may ibang side effect.
Right. So parang babalance mo lang
Yes.
talaga, no? Benefit
Oo.
versus harm, no? Sige. Eto na. Nandito na tayo sa ating favorite
Yes, this is our
segment
favorite
ng
part.
ating
diba?
show. Okay, so Dr. Pierce, there are so many myths about breast cancer. Let's bust the dangerous one. So ready ka na ba for fact or myth?
Yeah. Okay, let's go.
Sige, game. Doc Jello.
Yes po, no? The first question, Dr. Pierce, is, I think we've already touched on this earlier. Only women with a family history of breast cancer need to worry about it. Fact or myth?
Myth.
So it's a big myth.
Yeah, majority have no family history. And yun nga, you said men also, not just women.
Pati men.
And men. So,
Yeah.
kahit walang family history at kahit men, you have
Kailangan
a
ba
risk.
magpa-screen ang men?
Actually, hindi naman nagpapascreen ang men, but if they have a strong family history of, let's say, another male in the family, then yeah, maybe you should. Or if there's a lump that you feel,
Right.
then you should see.
Doc
the
Pierce,
doctor.
curious lang ako, ano yung youngest age ng females na treat mo?
Patient ko,
Oo, na patient.
25.
25.
Yeah. It's very sad, no? I just recently saw her, kasi nga, I saw her last year, and then she was lost to follow-up. I advised a core needle biopsy, but last year pa, but siguro unfortunately because of finances or hearsay. Sabi kasi ng relatives, no, she heard that doing a biopsy would cause her more harm and cause the mass to spread. So she never did. But natakot siya. So I recently saw her. Ang problema, kumalat na kasi siya sa liver, sa bone, at 25.
At 25, nag-mets na siya agad, no? Kumalat na.
Yeah. Who would have known, no? A 25-year-old would have breast cancer.
Right.
She has no family history.
Oh my gosh, wala pang family history,
Yeah.
25 lang siya. Dapat talaga, aware, kailangan natin ma-empower, no? Doc Pierce, ito may question ako. Ito very interesting. Sabi nila, wearing underwire bras, yung mga push-up bras daw, or using deodorants cause breast cancer. Fact or myth?
Myth, no? Definitely yung wearing underwires have nothing to do with the breast, no? Breast cancer. Unless na lang sobrang sikip siguro yan that it
Kung sobrang
restricts
push-up,
the
sobrang sikip.
blood supply of the
flow.
breast,
Blood
tapos na mabubulok na yung breast. Pero
Hindi mo na siguro hinuhubad yung bra mo. Nakahilipit lang siya na ganyan.
Other than that, wala siya. Deodorants, well, what I think is unless may mga yung
Chemicals.
mga EDCs, no, yung mga parabens siguro, then maybe it can increase your risk for breast cancer. But of course, we don't really have direct studies on that, like deodorants causing breast cancer. Wala tayong data on that, but we have associative data, you would say, on animal studies, ba?
Right. Wait, pero ibig sabihin, mag-deodorant ka pa rin. So, mag-deodorant pa rin po kayo.
Or proper hygiene pa rin.
Or proper hygiene, yes.
Pero interesting din, no, Doc Pierce, kasi sasabihin ng iba, deodorant naman yan, sa kilikili naman yan. Is that part, parang malapit, pero it's different from your breast. So, fact or myth, parang breast cancer is only in what many people think is the breast.
Baka
Pero
naman
pasok
yung
din mo bang
deodorant
kilikili
nila dyan.
sa breast?
Yeah, one of the possible presentations of breast cancer is axillary mass. So may bukol sa kilikili.
Bukol sa kilikili.
Of course, majority of the time, yung mga bukol natin sa kilikili are really not related to breast cancer, but it's a possibility. Whether
So,
siyang
kasama
presentation.
yun dapat sa kinakapa mo pag nagbe-breast exam ka?
Yes, kasi part of the breast tissue is actually in the axillary area, yung accessory breast. Oo.
So, kasi iniisip ng iba yung dito lang sa harap.
Sa harap lang.
So, kahit pala sa
Pa
gilid,
dito, pa
dapat
side.
Oo,
kahit
sa
sa gilid,
side.
kahit sa
Oo.
side, sinecheck din. Ito po, Dr. Pierce, no, sabi kasi nung iba, yung mammogram daw, because it also uses radiation, kasi it's sort of like an x-ray of the breast, the mammogram can also cause cancer. Is that a fact or a myth?
It's a fact, no? Radiation can cause breast cancer. Too much radiation, no? Yung mga nuclear war type of radiation, no? But the mammogram itself, the answer is a myth, no? But what I meant is that radiation itself can cause breast cancer. Cancers in general, not necessarily breast cancer. But yung mammogram in itself, it's too small. The radiation is too small for it to cause breast cancer specifically. But cumulative exposure to a lot of radiation, no? As we get older, let's say, ilang beses ka magpa-PET CT sa isang taon or kung ilang beses na
linggo-linggo, di ba?
CT scan, of course, it can increase your risk for all types of cancers.
Right. Okay. So, kaya may schedule din yung mammography natin.
So, too much
diba?
of anything talaga.
Oo, kailangan talaga balance.
But mas may benefit kasi yung mag-mammogram ka annually. Kasi you can detect very early cancers which can become treatable and with yung better prognosis and survival. So, ano pa rin siya, win pa rin ang early screening.
Mas maraming benefit
Yes.
pa rin to do it yearly. Okay, eto. Doc Pierce, ito medyo natatakot kasi yung ibang women. Ang sabi nila, a mastectomy is always better than a lumpectomy. Sadali, kailangan pala natin explain. Pa-explain muna pala mamaya kung ano ang lumpectomy. So, sabi nila, a mastectomy is always better than a lumpectomy for survival. Fact or myth?
Myth yun, no? Unang-una yung lumpectomy, it just means, misnomer actually yun eh. Lumpectomy means removing the lump. But we have, parang it's like a slang for breast conservation surgery, which means basically removing the lump plus a normal rim of breast tissue para may margins tayo. So, when we say lumpectomy, that is what we're talking about. So, when you say breast conservation surgery is actually equal to mastectomy in terms of survival. Hindi ibig sabihin, pag tanggalin natin yung entire breast, you would survive more compared to removing only part of your breast, no? But it might increase your recurrence or the chance for the cancer to come back kapag hindi ka magra-radiation after you do the breast conservation surgery.
Okay.
Oo.
So
But
would
it's
you
equal.
advise that yung iba 'di ba parang prophylactic mastectomy or si Angelina Jolie ba yun?
Actually, yun po yung next question din, di ba? Sa fact or myth. Fact or myth, Dr. Pierce, no? Parang if you have a strong family history of breast cancer, you should already just get your breast removed so that you remove your risk altogether. Fact or myth?
Difficult to answer strictly fact or myth, no? Of course, if you remove your breast, talagang wala ka ng risk kasi wala ng breast tissue eh. But of course, we don't do that, no? We actually advise our patients to do genetic testing to check kung may risk ba talaga sila. Si Angelina Jolie kasi, she was positive for the breast cancer gene. And if you're positive for the breast cancer gene, that means for yung BRCA1 and 2, no? And if you're positive for those, you have a risk of around 60 to 80%, as
Biglang
high as
tumataas yung
yes,
risk.
60 to 80% of having breast cancer on either side. So, syempre, and that's why she had the bilateral mastectomy. It's to decrease her risk. Kasi positive, I think, her mom and her sister. No? So, it was curative for her kasi wala na siyang breast tissue.
So, hindi rin basta-basta lang na
Yeah.
papatanggal mo
Patanggal mo na
lang.
pareho.
So, dapat
We cannot
evidence-informed.
harm the patient. Eh. We only do it to treat the patient.
Sige. Ito, last question na. Pero medyo nasagot na rin to. Pero, breast cancer is always a death sentence. Fact or myth?
Myth. Definitely myth, no? Nowadays, there's so many treatment options available. Tapos, if you get it really early, yung mga stage 0, the survival rate is more than 95%. So, parang it's the same as crossing the risk of dying when you cross the street. Diba? So, you know, you're like a normal person except that you've had surgery or you're taking this type of medication. So, that's what we're after, yung early detection, you catch it early.
May stage 0 pala ang breast cancer.
meron.
Pero napaka-hopeful nung statement na yun ni Doc Pierce na parang if you catch it early, you can live more or less a normal life. Diba?
Yes.
It's like crossing the street.
Yeah.
Diba?
So, huwag ka na lang tumawid.
Oo. Nako, mas,
Stay on your side
baka
of the road.
mas mataas pa yung risk mo na mamatay sa kahirapan at korupsyon
Ay,
kaysa
oo,
sa
talaga, sa baha,
breast cancer,
ganun.
or sa baha. If you catch it early,
Yeah.
diba? That's the message of hope. But thank you very much, Doc Pierce, for busting some myths and also enlightening us with some facts. Ako na, yung pinaka-enlightening fact talaga is pati kilikili.
Kailangan kinakapa mo.
Dapat chinecheck din
Chinecheck
kasi
mo.
and hindi lang sa bukol lagi. So thank you very much, Doc Pierce, for clarifying some facts and busting some myths.
Dito na tayo sa next segment naman natin. No? So now, let's go to some practical questions our listeners have sent for Dr. Pierce. So, ito naman, these are concerns that keep women awake at night, no? Pag medyo kinakabakabahan ka.
Yeah,
no?
so,
Yan.
and I think, Doc TP, for these questions from our community, from our Cura community, we'll get real and practical talaga.
Sige.
Like this first question from Jennifer. Doc Pierce, you mentioned kanina na for screening, you have mammograms and ultrasound. So that's like the first few tests that will be asked of you. And Jennifer asks, Doc Pierce, ang mahal ng mammogram tsaka ng ultrasound. Tapos, aside from the fact na mahal, she says she's also scared kung ano yung makikita. So, huwag na lang daw siyang magpapatest. Like, she asks here, no, do I really need one if I feel fine naman? Tapos, mahal pa yung mammogram at ultrasound.
Yeah, unfortunately, medyo mahal nga siya. I think there are public hospitals which offer naman these tests and they're free. So, all you have to do is exert the effort to be screened. So, yan yung kailangan natin gawin on our end. Diba? Tapos, if you're feeling fine and you don't palpate anything, pwede namang hindi ka muna magpatingin maybe if you're younger. But if you're older na at 40, the risks are higher, then we really need to do this. Kasi it's like, we have to take care of ourselves.
Right,
Diba?
right. Jello, ikaw, may alam ka ba, like, PhilHealth coverage, di ba?
Yeah,
Baka
oo.
pwede sila mag-avail of, like, mammograms through the Yakap centers?
Tama yun, Dr. Pino. Surprisingly and thankfully, no, even if our health system is not perfect, no, one of the benefits that we can avail from your PhilHealth membership, also made possible kasi universal health care na nga
Universal
tayo
healthcare,
ngayon, di ba?
yes.
Na apparently, and ngayon ko lang na-discover through my mom, na
Hello
yung...
po, magandang
Opo,
gabi.
hello po sa aking mga magulang.
Yes.
Na ang mga breast exams, no, and yung mga mammogram are also covered pala by the PhilHealth outpatient benefit package, yung yakap natin, no. So,
Kailangan talaga explore natin ano yung available pala sa through PhilHealth,
and
no?
to Dr. Pierce's
Yeah.
point, no, sa mga government hospitals, libre
Yes.
naman kung may
Yeah.
PhilHealth ka. So, yung main barrier lang talaga is yung sarili mo eh. Kailangan mong labanan yung
Yung
takot.
fear, yeah.
Yes, ito naman, may isang question din ako dito galing kay Rosa. No? My mammogram report said I have dense breasts. So, what does this mean for my cancer risk and screening?
Studies have shown that yung dense breast can be a risk factor kasi pag dense, ibig sabihin makapal na makapal pa, very, parang sa Tagalog, I think the best translation, parang malited. No, sometimes,
Malited yung breast.
well, ano
Matigas
ba,
na yun.
very dense, parang makapal. So sometimes pag makapal, pag iniipit or siniscan, maybe there are small masses na hindi nakikita.
Hindi agad nakikita.
Yes, so maybe that's the reason for the higher risk. No, but it's quite common in younger women. Dense pa talaga eh. If you see younger women, di ba, have perky breast kasi very firm. And as we get older, it becomes more affected by gravity.
But it's a reality. Di ba? It's a reality.
Because nawawala na
So,
yung...
so, ibig sabihin ba nun, pag malalaki yung breasts, higher risk of breast cancer?
No,
Ganun ba yun?
no naman. No,
Hindi
it doesn't
naman?
matter whether you have big breasts or small breasts. The risk is the same.
Okay, pero yung density lang, dahil hindi mo nakikita.
Kasi hindi mo nakikita. Oo, mas marami yung chances that you miss out or you miss detection of a specific mass.
But also, Dr. Pierce, does it mean na it also doesn't mean that if you have perky breasts that you are at higher risk?
No,
naman.
no
Mas
naman.
difficult lang or may challenges
Yes,
lang in detecting
yes.
a lesion. No?
Or a mass, no? Pero,
Yeah.
like, halimbawa, yung ba yung value na kasabay ng mama mo, pa-ultrasound to, makikita ba yun sa ultrasound? Kung halimbawa, dense din yung
Yes,
breast mo.
usually for younger women, we recommend an ultrasound. Kasi yung ultrasound, what they're looking at is kung ano yung bukol na nakikita, if laman or tubig. So, it's a different type of test, which is complementary to a mammogram. Normally, we don't ask mammograms for we do not ask them for younger women, less than 40 years of age. Kasi nga, dense yung breast nila. Once the mammogram compresses it, walang nakikita. It's just breast tissue which is layered.
Okay.
Oo.
So, mas wala talaga kasi
Wala
parang
talagang
patong-patong,
nakikita.
ano. Yeah, oo.
Yeah. So, thank you, Doc Pierce, for clarifying that. Ako, na-pick up ko doon. It doesn't mean that if you have perky or big breasts, that you are at higher risk. Wala yan sa size or sa perkiness.
Patas lang yan.
Patas yun sa lahat.
Patas yan, no?
And I think, di ba, ang message naman din is parang, regardless what your shape or perkiness is, you are beautiful. Di
Oh,
ba?
yes.
Oo naman.
Oo. of course.
Oo. Ang mahalaga is you're also breast cancer free, di ba?
Kaya, regardless, kailangan pa rin magpa-screen.
Kaya
diba?
kailangan pa rin
Kailangan
magpa-screen.
Early detection pa rin.
Yes. And we'll move on to our next question naman po. This time from Patricia. Sabi dito ni Patricia, I've heard that sugar feeds cancer. And that soy also causes breast cancer. Like if you eat a lot of soy products like tofu or soy milk. And that I should avoid dairy. So she mentioned 3 foods, Doc Pierce. Sugar, soy, and dairy. Naku, ang dami kong alam na
Wala ka nang
ulam
kakainin.
na merong ganito. What should I avoid among these foods? Which one should I avoid to lessen my risk of breast cancer?
What I tell my patients is that they have to eat a balanced diet. Too much of anything is really bad, no? Too much sugar is bad because it feeds the cancer cells, yes, but it also feeds you. So if you don't eat, edi, what will happen to you? So you cannot have too much. You decrease your sugar intake, definitely. The useless sugars, junk food, and the sugary drinks, dapat talaga
Out
we
na.
take it out. Kasi wala naman siyang essential nutrients. It's actually really just zero. It's a zero type of food, no? It's useless. Yung soy naman, it's conflicting. Some studies will say it increases the risk because it's an isoflavone, so it mimics the estrogen effects. But in other studies naman, it shows that it's actually protective. No, it doesn't react in the same way as estrogen dun sa feedback loop kasi. So it actually does not increase the risk for cancer. So I would say take everything in moderation. Dairy, not really, unless you increase your intake so much that increases your fatty oily intake, then that can increase your risk.
Yeah.
Everything in moderation. So, pwede pa rin ho kayong kumain ng
Pwede pa rin.
tofu,
Definitely.
ng
Yes.
milk, di ba?
Yes. Although at tofu, di ba sinasabi nila yung GMO, yun yung, kasi
yeah.
soy, di ba?
Yeah.
Parang yun naman yung, okay, kailangan din i-monitor, tama, Doc Jello, in moderation. That's the term tonight. Okay, ito naman, tanong ni Maria, I'm on birth control pills. Does this increase my risk of breast cancer?
Yeah, depends on how long. Birth control pills kasi nowadays, it's different as opposed to yung several decades ago where they studied the hormonal replacement therapy, which if you take for more than 10 years, it decreases your breast cancer risk. Yung mga birth control pills naman ngayon, although they may have similar ingredients as the hormonal replacement therapy pills, I think you should have a conversation with your gynecologist if you're taking it for a long period of time, let's say at least 5 years continuously. I would be very careful about taking it continuously for 5 years, at least 5 years. And of course, if you have a strong family history, then you shouldn't be taking contraceptive pills because these are hormones. They're comprised of the same hormones as your hormonal therapy pills. Your hormonal replacement pills.
Yeah.
Ito naman, Doc Pierce, no? From Lisa, can stress cause breast cancer?
Not directly. Stress can increase our risk for hypertension,
Any
diabetes. Like it can increase for all types of diseases. But of course, if you can reduce your stress level, let us know.
Diba? Oo.
Or parang kailangan talaga natin tips to manage stress. Kasi
Yeah.
talaga naman lahat tayo may stress, di ba?
And maybe
Yeah.
not direct, but yun nga, if you're stressed and then you stress eat and you eat unhealthy food, di ba? So,
Yeah.
maybe not direct, but still, di ba, we would want to avoid stress pa rin for general health
Or
reasons.
manage
Yeah.
stress talaga, no? Ito, sabi naman ni Grace, if I need a mastectomy, do I need to have reconstruction? And when do I have to decide?
Of course, that's one of the treatments that we offer now, yung mastectomy with reconstruction, no? It's so nice kasi a lot of women, I noticed that my patients who undergo reconstruction, that the transition is easier. Parang they don't feel as depressed, they feel more normal, no, when they have reconstructed breast, no? So you don't have to decide, of course, if you want immediately in the same setting or in the same surgery as the mastectomy. You don't have to have it done immediately. If you're not sure, then you can do your reconstruction afterwards. Kaya lang, if you do it at the same time, mas maganda lang yung cosmetic appearance because the incision is smaller as opposed to doing a mastectomy before, tapos and then maybe 6 months, a year after, then you decide to do reconstruction. You have that long scar already, but there's still a breast. Oo.
Yeah. Would you recommend to have a reconstruction done in general?
Yeah, I always, it's a conversation that I have with my patients all the time. It's always offered. However, the problem is cost, no? It's much more expensive, the surgery is longer, so there are a lot of factors. But I've never met any patient who didn't want reconstruction. It's like a free pass, eh. They have some, one form of reconstruction is using yung or belly fat, yung tummy tuck, yung bilbil.
May
So,
tummy tuck ka na.
so parang may tummy tuck ka,
Tapos,
parang
oo.
okay, you have breast cancer. Parang matuwa ka na lang na itong consuelo na you get a free tummy tuck, free pass. Diba?
Pwede pala yun,
Yeah.
di ba? But of course, we don't want to wish breast cancer on anyone just to get a
Of course.
tummy tuck, di ba?
Mag-exercise ka na lang para...
Oo. Pero I think ang ganda ng sinabi ni Doc Pierce na parang more than the cost. Of course, the cost is a consideration, but quality of life, I guess,
Yes,
di ba? Quality of
definitely.
life is
Tsaka
also
na-mention mo nga
important.
yung depression that may come after
Yeah.
a diagnosis or intervention.
They're
no?
so much
Yeah.
better. They seem to be happier after surgery. Parang it's not such a big deal for them compared to people who've had total mastectomies. No, I noticed that my patients in the recovery room, when they wake up, the first thing that they do is they touch their chest, tinitingnan kung meron pa o wala. That's what they do, eh. That's what I noticed. So, I wish, it's an option sana na everybody could have, at least if they really wanted it.
And na sana dapat cost shouldn't be
An
a
issue.
barrier or an issue, especially when we talk about quality of life and happiness. Ito naman po, last for our community Q&A. This one is from Miguel. So we have a man asking, how can I support my wife who was just diagnosed with breast cancer?
That's a good question, no? I think you just being there, that's enough, more than enough support, eh. Yung, even if you're not talking, basta bringing her to the clinic, just being beside her, I think that's a lot of support, eh. Just being present at all times and try to assist her in every way. Parang yung mga unconscious cues.
The small
The
things,
small
no?
things, yes.
Yeah. So parang
Oo.
journeying with
Oo.
the woman.
Yes.
Diba?
So ang ganda na kasi it's not just a woman problem, di ba? Parang it's also, well, Doc Pierce, you mentioned that men can also get breast cancer. But, as men, we also have our mothers, our sisters, women in our lives that we can definitely support. And the support will mean a lot.
Yeah. Galing. Sige. So, medyo pa-wrap up na tayo. Doc Pierce, if you could give women one action to take today to reduce their breast cancer risk, what would that be?
Oh, maybe you should take charge of your health, no? We cannot just sit down and just let it, engulf us. We have to do our part and take charge.
Empowering women talaga.
You hold the
Yun ang-
health in your hands.
Yes. At saka hindi mo iaalay lahat sa doktor, di ba? Hindi nakasalalay sa doktor. Meron ka talagang role na pwedeng i-play dito.
Ikaw, Dr. P, very quick tip from
Very
you.
quick tip from Tipi.
Yes. Oy, maganda yon. Pwedeng ilagay natin yon sa susunod na segment, di ba? Tip from Doc Tipi.
Ayan. Sige, ito naman. Know your breasts. So, pwede siya malaki, pwede siya maliit, di ba? Pwede siyang defined by gravity, sabi nga.
Pwede
ni
may
Doc.
pangalan.
Pwede may
pangalanan.
pangalan, yes. Pero, know your breasts and this is different from a formal self-exam, no? So, women need to know their breasts, how they look, how they feel like, para malalaman mo kung may changes na doon sa breast mo rin. May bago bang bukol? Meron bang parang yung indentation na sinasabi? O mukha ba siyang balat ng orange? So, tapos, pati yung nipple, tignan mo rin, meron bang lumalabas sa nipple mo? Meron bang dugo? Meron bang... So, parang kilalanin natin yung sarili nating katawan, be comfortable with it, no? So, I guess yun yung tip ko for the women listening tonight.
And ako, Doc Tipi, babalikan ko rin lang, no? Parang, especially, the swaps that we can make, one is to reduce the plastics in our lives. Diba? I mean, I'm sure it's very difficult, but if we can
Anong
reduce...
plastic? Tao? Or lalagyan na
Both, diba? Oo.
Kasi stressor yung plastic na tao.
Yung plastic na
Ayan,
tao,
okay.
stressful din yan. Pero also yung totoong plastic kasi sabi, mga endocrine disruptors, most of them are found in plastics. And siguro basahin po natin yung mga chemicals, like when we buy shampoos
Sa
or...
likod, no?
Yeah, or
Hindi lang
personal
yung
care
harap na
products.
brand ang
Diba?
titignan natin.
Agree.
Paano ba magbasa nun, Doc Jello?
Babalik na rin lang po natin yung produkto, di ba? Pero maganda rin sana, may action yung government. Kasi minsan, ang liit ng font di ba? So you can't expect everyone to read it when it's so small.
Or ganyan kalayo babasahin.
So very helpful yung mga nire-require mo yung mga products na sabihin paraben-free or phthalates-free or toxics-free. Sana ma-mainstream po yun para maprotektahan yung mga tao. Yeah.
Ang galing. So, concrete action yun. Diba?
Yeah.
Magbasa ng labels. Yan yung gagawin natin. Okay. So, Dr. Pierce, for listeners who want to learn more about breast cancer or schedule screening and resources and parang mga things about breast cancer, meron ka bang mga resources na pwedeng i-share sa kanila na dito tayo pumunta, ganyan?
You can actually try yung nccn.org. www.nccn.org. Meron there's a part there where they ask whether you're a patient or a doctor, and that resource is actually free. You can just it's very easy to
Ano ba
read
NCCN?
through National Comprehensive Cancer Network.
Oh, okay.
Oo.
Tapos may segment doon on
Yeah, may
breast
segment for
cancer.
patients, may segment for doctors, no?
Okay.
Oh, and that's a very helpful
Tapos
resource.
free
No?
tip,
Yeah, it is.
free
It's for free.
resource
It's
siya,
for
diba?
free.
So, it's how we empower ourselves, diba?
Yeah.
Through knowledge, and we have that resource. Thanks for that, Doc Pierce.
And Doc Pierce, how about, because you also have the breast clinic in the medical city, so what are some resources or services that you offer sa breast clinic?
The nice thing about the Medical City Breast Center, it's actually a one-stop shop. So you can have your digital mammogram, your breast ultrasound, and you can also have your procedures there, like ultrasound-guided core needle, fine needle, mammotome biopsy. It's all there. So they can just go in, have themselves. They can consult also. They can consult a surgeon there, and then she can go through all of these procedures if she needs to.
One-stop shop.
One-stop
siya talaga.
shop.
And I'm sure there are also other hospitals naman, diba? Hindi lang naman isang hospital lang to sa Pasig. Parang na meron tayong mga ganong kinds of services.
Yes,
din.
of course.
Yeah. So, Dr. Pierce, maraming salamat. Thank you very much for this incredible, informative session. At saka, sobrang you bring us hope during this conversation. No? So, any final messages for our listeners? Final na to talaga.
And also anyone you'd like to greet,
O may
diba?
kapag gustong
Oo.
batiin dyan, like, shout outs.
Hi to my family.
Ayan, hello daw.
Hi to the people in the breast center.
Ayan.
And to the patients who are listening, hello.
Yeah, nandito
Yes.
si Doc Pierce. Pwede niyo po siyang mahanap. Alam niyo na kung nasaan siya.
And I think ako ang key takeaway ko talaga dito, Dr. P, is that, there's hope. Breast
Yes.
cancer is not a death sentence.
Right.
And there are resources that are available to us. And, knowledge really saves lives, Dr. P.
That's
knowledge of
true.
yourself, knowledge of these resources, it can save your life and your family's life.
Yung mga loved ones mo talaga, no? Thank you, Doc Jello. So, next Monday po, we're talking about autism. Actually, a topic that's very close to my heart. At sasagot po tayo ng mga questions from parents. Nakakatuwa yung guest natin next week kasi sibling siya.
A sibling.
A sibling of an adult na yata. Parang basta a child with autism.
Ang
So,
galing,
sibling
ang
siya.
galing.
Yan,
So from the
abangan
perspective
natin
of a family member.
yan. A family member talaga.
Yeah. But until next week, una-una, thank you very much, Dr. Pierce. But until next week, take care of yourselves, know your bodies, and act on what you have learned today. Once again, I'm Dr. Jello Apostol.
And this is Dr. Tipi Sumpayco Tanchanco from Cura. Stay informed and stay hopeful, Ateneo. Magandang gabi po sa inyo lahat.
health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion,
Where care